somebody asked in my comments on TikTok if Monsplasty could disrupt the lymphatics. So what are lymphatics? They drain all the fluid, the interstitial fluid that's not in the vascular system, back into the vascular system. And in that process, it filters through the lymph nodes, which are part of your immune system. You have nests of lymph nodes everywhere, on your neck, under your armpits, in your groin creases. For the Mons in particular, they're really more lateral to that. They're in the groin crease. But lymphatic injury is actually a risk with a ton of different operations. So with brachioplasty, lymphatics up in the axilla, with thigh lift and even abdominoplasty, I often see the inguinal lymphatics. And that is a risk. We do discuss it on the consents. There are a couple things that definitely make it less risky. And one of those is staying really superficial with the skin excision. So when I'm doing abdominoplasty, I stay way above the lymphatics there. If I'm doing something like thigh lift or Monsplasty or brachioplasty, I actually use liposuction to dissect out that deep plane. So I'm like elevating the skin using the liposuction cannula to separate the fat from the overlaying skin. And that helps preserve the lymphatics. But yes, technically swelling is a risk, and I've seen definitely prolonged swelling after thigh lift, but true lymphedema is pretty rare unless you're taking out several of the lymph nodes.